I'm Julie Harper. I'm a dermatologist, board certified. I practice in Birmingham, Alabama, and I am involved with the American Acne and Rosacea Society and one of the former past presidents of the society. There is a new agent on the horizon in acne. The name of the product is Denifanstat, and it is a FASN inhibitor, which is a fatty acid synthase inhibitor. And it's a really unique mechanism of action for us in acne. Now, we know we still have those four main pillars that we're always trying to target in acne, and they are hyperkeratinization and inflammation and sebum and C. acnes. And traditionally, the hard one to hit has been sebum. And this oral medication, Denifanstat, is a product that can reduce sebum. It also reduces inflammation, but the real target of this drug would be sebum. I think one thing that's really different about this in the acne space is that it targets sebum. If you think about the other products right now that we have that do that, the oral medications, two of them at least, and only one of them FDA approved, if they're targeting sebum, we can only use them in women. And that would be combination oral contraceptives and oral spironolactone. Contraceptives, some of those being FDA approved, spironolactone not being FDA approved to treat acne. And then, of course, there's oral isotretinoin. We can use this in any gender, and it is a medication that works very well, but there are reasons that people don't want to take it. It also carries with it that risk of teratogenicity. So it does have some limitations to its usefulness, mostly through a safety standpoint. But Denifanstat is going to be working on sebum. We can use this in either gender because it's not working through a hormonal pathway. It does not carry with it the same teratogenic effects that isotretinoin has. And so really, really unique and really promising and hopeful for our patients with acne. So this has already been studied in phase 3 trials outside of the US. The studies were done in China. They enrolled 480 patients. This, though, was a double-blind, randomized, placebo-controlled trial. This is an oral medication, so Denifanstat 50 milligrams, randomized 1-to-1 compared to placebo, 12-week studies, and it met all of the primary endpoints. And so what are those primary endpoints in acne? They're going to be IGA success. So how many people who started out with moderate to severe acne were clear or almost clear at the end of the study? And I can tell you the numbers around 34% or so, and that is double what was seen in the placebo arm. But it also met those endpoint of reducing both inflammatory and non-inflammatory lesion counts. Safety looked really good in this study too. We also have an extension 40-week study. Now everyone is on drugs, so this is open label, 240 patients. So now, at least for some of that group, we have 52 weeks of data that looks at safety. And really the only things that pop up at a rate of more than about 5% are dry skin and dry eye. So no serious adverse events that we're seeing with this drug at all. The whole reason we treat acne really is quality of life. And it's important that we give our patients new promising medications like this, because many people come to clinic and they've already really tried everything. And if they haven't tried everything, they have reasons why they don't want to try some of the medications that are out there. For example, maybe it's a young woman who would really like to take isotretinoin, but she's a little concerned about, does she also have to be on some kind of birth control, which the answer is usually yes to that. And so just, giving people an opportunity to have their acne cleared up with a novel mechanism of action is so important. In the studies, we always talk about IGA clearance. We always talk about lesion count reduction, but it's very important that we're always looking at patient-reported outcomes. Are patients satisfied with the treatment with these drugs? Because that's the endpoint that really matters. I like to look at my patients, and if they're not all the way clear, I'll say, I know you don't want to just be better. I know you want to be all the way clear, and that's my goal for you too. And, so often, and this is what I say to them too, it doesn't take just one drug. It takes finding the right recipe, using medications in combination, oftentimes targeting these different mechanisms of action so that we improve not just what we see on the skin, but the patient's quality of life as well. For many years in the acne space, I do think we've made advances, but we have kind of reinvented molecules that we've already had. And it is just, I just want everyone to understand that this is a really new novel mechanism of action that we haven't seen in dermatology before, not just in acne, not in dermatology. And so it's exciting that we have this ongoing research, because as far as I can tell, we have not fully defeated acne yet. My clinic is still full of acne patients who are still wanting treatment for their acne. So I'm just really grateful for this new and novel, exciting potential agent for us that's on the horizon, and maybe even the relatively near horizon.